So, good morning, team. My name is Roxanne Whittingham, and this morning we are here to examine the case of Lisa. I'm going to start by reading through the case study just to refresh our minds as we get into the discussions. So, you are currently working with Lisa, an 18-year-old woman who recently found out she is pregnant. She suspects she may already be in her second trimester. Because she was unaware of the pregnancy, she continued her usual lifestyle, including drinking alcohol and occasionally using marijuana on weekends. Lisa lives independently and has a strained relationship with her strict and religious parents. She is fearful of how they might react to the news. She is also a full-time university student and hopes to continue her studies, especially since she believes her due date will fall in summer. Although she is no longer in a relationship with the baby's father, they remain friends, and he is excited and willing to support her. Now, we are tasked with discussing the impact of this case from an individual, family, community, and societal perspective. So today, this is what we're going to explore. So again, reintroducing myself, I am Roxanne Whittingham, and I will be exploring these discussions from the lens of a graduation coach working with high school students. And I'm also closely, my work ties closely to supporting kids, students in the university level. So first of all, I will say in terms of the individual impact, I'm looking at this level. Lisa is navigating a complex mix of emotion, right? So there's a mix of emotional, physical, academical, and developmental challenges. Now, discovering that she has already, moved into her second trimester, this can be overwhelming for any young person, but especially for an 18-year-old who is still transitioning into adulthood. As someone who works with, as both a graduation coach and as a mental health professional, this is a type of situation where we often see students experience shock, right? Those are some of the emotions that are flooding in. You're going to have shock, there is fear, there is guilt, there is uncertainty, and all of those pieces are just flooding in all at once. Like it's just a total emotional roller coaster right here. Now, because Lisa consumed alcohol and marijuana before knowing she was pregnant, she may not worry, excuse me, about potential impacts on the fetus. And quite naturally, even though she did not knowingly put the baby at risk, young people in her situation, and from my experience, I've seen that a lot, often experience heightened anxiety. There is going to be self-blame and intrusive, what if thoughts. What if, right? What if I didn't do this? And what if this happens as a result of my, you know, drinking, excuse me, and as a result of me using the marijuana? What ifs, a whole flood of what ifs. And we've all been there. Now, these emotional reactions can affect her mental health. They can affect sleep, concentration. And we have to remember now that she's a student, right? And concentration is going to be of utmost importance if she wants to be successful in her studies. But we can see here that her overall functioning is going to be distorted. Now I could go on and on, but I'm just going to pause there for a bit and allow the next person to come in. And then, as we go around in the discussions, I will pick up again from some of the physical impacts that, could be potentially affecting Lisa. Thank you.
Okay,
I
thank
hand
you
over
so
to
much,
Patricia.
Roxanne. Yes, can you hear me?
Yes,
Thank
we're
you so
hearing
much,
you.
Roxanne, for that. My name is Patricia Toyo, and I'll be talking from the Wellness and Family Counselor perspective. Right now, Lisa seems to be going through a tough time, and for someone who already has a strained relationship with our family, especially coming from a strong religious background, there's already emotional distancing with that. And this new development of her being pregnant, especially out of wedlock, could further compound the family situation and increase our stress. And as we know, for someone who is pregnant, especially in the second trimester, we need to reduce our stress level as much as possible. So my goal will be to help with family reunion where possible, because it might not be possible, especially if it will further distress Lisa. My goal essentially is to help increase our support system. So it's great that she has a boyfriend, even though he's now an ex, who is going to be
Mhm,
supporting her with the baby's upbringing and however support she needs emotionally or thereabout. But it is also important to try to expand our support system. So,
mhm,
first, I would like to look into what was the reason for the strain. She has already alluded to some part of it, that she continued her lifestyle, drinking, and the use of um, substances, even without knowing that she was pregnant. First, I would also be working with a family physician to see how we can
mhm,
improve our wellness, check if there's already any established deficits to the fetus or even to Lisa. If there's none, that's great. We will continue with prenatal care. And I think you have already resorted to if there's health facilities, medical facilities within the university that can help her, that would be great. More so looking
mhm,
at the family structure. Um, this could go both ways. It could be that the news of a grandchild could soften the heart of our parents to be able to
mhm,
bring her closer, because some
mhm,
cultures, any most grandparents, I think some of us can allude to it. Once they have a grandbaby, all your sins are forgiven and everything. I hope that's the case for Lisa's case. In the event that this is
mhm,
not, we want to look at how being a single mom in a school or a pregnant lady in a school would impact our studies. And coming from a strict religious family, there's possibly trauma from that relationship that we want to make sure she doesn't pass on to our baby, so that we don't continue the cycle of trauma in this case. Also, we'll be exploring parts of counseling, if we can have like group counseling for her and her family members. So let them see things from Lisa's perspective and see how they can support her during this current time. I think I'll be handing over to Laura for now.
Lisa's uncertainty about where to access prenatal care demonstrates the gaps in outreach, in education, and a coordination of services. So, this suggests that communities just might not be providing clear enough, accessible pathways for young individuals who do get pregnant. So because they can't learn about the supports, or connect with youth-friendly healthcare providers, and also receive guidance in navigating prenatal and social services early on, which I think is important. Community health clinics, public health nurses, and university health services, most importantly, can serve as key supports within Lisa's zone of proximal development. This can happen by providing developmentally appropriate guidance, education, and emotional support that help her build the parenting knowledge, coping skills, and gradually increasing her confidence and independence as an expecting parent. From an education standpoint, teen pregnancy can often be seen as a barrier to academic achievement. So, communities might want to focus on providing the academic accommodations for Lisa, childcare supports, and even flexible learning options to help the young parents remain in school. Um, I think this will help support her both cognitively and emotionally during her pregnancy. And lastly, I'm going to look at peer relationships. So these may also shift as Lisa's social identity changes, potentially increasing isolation. But community involvement, I think, will definitely help her build connections with others who are facing similar experiences. This could reduce Lisa's feelings of isolation, and it could also provide her with a supportive space to share any advice, encouragement, and also just understanding people and having people around her that truly can relate to her situation. And then, like I said, later on, I'll look more from a therapist perspective in Lisa's case. But for now, I'm just going to pass it on to Satemi for the societal perspective.
Okay, thank you very much, ladies. My name is Temi Oluwafemi, and I'll be talking first of all from the societal perspective on Lisa's case. And when I look at Lisa's case, I like to think about like look at it like in a bigger picture, like what are the norms and what are the kind of expected what are things that are expected for someone at that age. So first of all, I'll talk about the stigmatization in Lisa's case. We see that she came from a family that is a very cultural, like very religious, strict family. And the fact that she's 18 and teen pregnancy in such instances like cultural and strict religious environments can actually be met with a lot of judgment, a lot of moral judgment. Or maybe let's even say, for instance, maybe Lisa's father was a pastor or something, or someone very, important personality in the church, and finding out that your child is pregnant at 18 years old, how the stigma the family alone is going to face. So the kind of stigma can actually push someone like Lisa, for example, in her case, away from like getting care early. She might be scared that, oh, I don't want my parents to know I'm pregnant. I don't want my parents, church members, to know I'm pregnant. I don't want to be like a shame. I don't want to be like the black sheep of the family. So that can give her fear. That can put fear into her from like coming out early that she's pregnant, or and I can even like, and in her case again, we see that she said that she didn't know she was pregnant, but she actually been taking alcohol and taking marijuana. Even aside from pregnancy, for someone that comes from a strict and religious family, seeing their child taking alcohol and marijuana is something that can be labeled like, oh, she's the black sheep of the family. So when somebody, people in the economy, in the society, gets to know that she's actually taking all those marijuana and alcohol coupled with the pregnancy, there will be a lot of stigmatization. So, and because it's so stigmatized, someone like in Lisa's case, she might begin to have the fear that our child is going to be deformed, because we know that starting from a nurse perspective, we know that if someone is pregnant and you keep on taking alcohol or marijuana, at the end of the pregnancy, there's like possibility that the child might be have some delayed development or might be deformed. So that the kind of stigmatization she might face, she might be actually scared to like talk about it. And I also want to look at the let's say the structural determinant that are expected for and someone at 18. At 18 years old, you're still in high school. At 18 years old, we don't expect you to have like a steady income. You can be working like just a little bit of work just to move, but steady income. So like in Lisa's case, she definitely might be dealing with financial stress, because for in her case, she has a very strained relationship with her parents, so that she doesn't really have any support from anywhere. She's actually working herself
to finish school. So like she might be dealing with financial stress like tuition and rent and even possible food insecurity. So how is she going to be able to feed for herself and the newborn baby, even though the supposed father said is going to contribute, but someone that you don't live with, how do you expect him to contribute 24/7? So there might be a strain. There will definitely be a strain on financial aspect, and that can make and maybe like she will have that would like on she have an unstable family support because her parents, she doesn't have a close relationship with her parent. But like my colleague said earlier, some grandparents, some parents like country I come from, when they don't accept the pregnancy, but when they see that
Mm.
the grandbaby is
Mhm.
coming, they end
Yes.
up giving in, they end up like giving
Mhm.
in. So, but we never can be so sure in this Lisa's case. So, but and the key point is that in here is that these are not personal failure. You should know that
Mhm.
she also said that the system level that it has to shape how we see pregnancy, that we shouldn't just see that, oh, this person is pregnant, we should stigmatize them. We should also see the fact that they're actually moving into another phase of life, because there's someone that can get pregnant at 18 years old, you're no longer a baby. If you have a child yourself, you are no longer a baby. So we shouldn't see Lisa as a baby. The society cannot term that as a baby anymore, so they have to term her as an adult that's already responsible for a life, for life of somebody.
Mhm.
So I like to see it in that aspect. And also when we talk about the in terms of nursing, the healthcare system, Lisa, she doesn't even know where to go. She didn't even know she was pregnant, because it's
Mhm.
someone that is at the age of there's no, I don't want to say there's a particular age that is due for pregnancy, but someone that is if someone is learned enough to know that, oh, I'm pregnant. You already know the steps you start taking. You know you have to go to antenatal, you have to go to see a doctor, you have to do all that. But she didn't even know, she already entered that second trimester. She didn't even know where to go. So that can be like that can create a very big like gap between her and the successful pregnancy. So if we know that if there's a delayed care in care in terms of pregnancy, there can be a very very bad impact on the pregnancy. So these are a couple of things that we like to add in, and also see that she's trying to struggle her way back into school. How does she want to juggle school and juggle being a mom? And she doesn't, and for her, she thinks that it's easy for her to run the school and be pregnant, carry the pregnancy. But when she doesn't have support, I want to use that case, when there are not enough support, like Lisa's case, there's a lot of risk will increase. Like she definitely might end up having to drop out of school if she intends to keep the pregnancy. So she like kind of have to drop out of school, and she kind of face long-term poverty because she doesn't have the income to take care of the baby and herself. And at the end of it all, we see that there'll be definitely mental health strain on her, because carrying a baby is like, I'm talking from experience myself, carrying a baby and not having a supportive partner or supportive family or society to or even friends to help you along the journey
Mhm.
can actually have a very negative strain on the mental health. So there's a couple of things I see from the societal perspective. I will just pass on to my colleague that has anything to say about their professional aspect. Thank you.
Oh, some very, very good discussion, some very good points, as we look on the different levels of how Lisa will be impacted, right? And we're going to explore that some more when we wrap up. But I want to just touch base a little again on some of the individual impacts as I started out. And I want to look a little bit, on the physical portion. And as Satame, made some reference, right, to her age and the different things could be affecting Lisa at this time. And I'm expanding on that to say, physically, Lisa may be processing, like rapid bodily changes, as you were saying. How do they expect, like somebody at this tender age to handle pregnancy, right? So here it is that she is processing rapid body changes without having had early prenatal care. And back to what Setami had said, not even realizing that she was pregnant to get that early care. Now, this can increase feelings of vulnerability and fear about her health and the baby's health. She might also be aware of what steps to take next, which can add to her stress. And I think some of those points came out as everyone was, chiming in from the different, topics that we're addressing today, right? Um, on an academic level, Lisa is balancing full-time university studies while trying to make sense of this major life transition. And certainly just said, she is possibly thinking that it's going to be easy to handle, dealing with a baby and her studies, and it might not necessarily be the case. But what we're happy for is that she herself has demonstrated that amount of resiliency, and that resilience and that personal desire, I think, is going to really help, determine the success of both the outcome of the baby and the outcome of her education. Now, I'm looking from a graduation coach perspective, right? Pregnancy can really impact a student's attendance, the energy levels, and ability to meet deadlines, right? She may also worry about stigma from peers, and that also we can see in the society. Stigma from professors, or which can lead to withdrawal, maybe reduced engagement, or even thoughts of dropping out. All of those factors can pop up in her mind. Without proper support, these academic pressures can compound her emotional stress. And so that is why, when we work as a team, from like as a graduation coach, we usually have a support system that wrap around students to ensure their success. So like we have here on this case study, in the school system, we have the social worker, we have a mental health person, we have like a student success officer, and sometimes the administrative staff would come in to do a wraparound and ensure that we're supporting a student like Lisa as best as possible, right? And hoping that individually in her own mental space, she doesn't think that it's too overwhelming. But I'm quite happy about the fact that she is personally demonstrating that resilience. So that is a key piece that I really want to look at. And then financially. So Lisa is living independently, and she may already be under strain. Now, the added costs of prenatal care, transportation, baby supplies, and potential time away from work or school can create significant pressures, right? We can see how that can be really stressful. Now, young adults in similar situations often feel overwhelmed by this sudden shift from planning for their future to planning for a child. So you see the whole dynamics here. Initially, she was just thinking, okay, I just want to finish school, get everything done, move on to my career. And here comes, what quote unquote somebody would say like a bump in the road, right? But despite these challenges, Lisa demonstrates resilience, like I said earlier. She's expressing a desire to seek prenatal care, which is a very, very positive move. She wants to continue her education and make informed decisions moving forward. Her ongoing friendship with the baby's father is very critical here. And I'm very happy that, that there's an indicator that he is supportive and he's excited and wants to serve. And this really serves as a protective factor for Lisa, her mental health, and for the baby. Now, supportive relationships are one of the strongest predictors of positive outcomes for young parents. And so we're happy about that as we explore this case. Now, from a mental health lens, Lisa would benefit from early intervention supports such as counseling, prenatal education, and case management. And we've all touched a little bit on that. As a graduation coach, ensuring she has access to academic accommodations, flexible scheduling, and student parent supports would be essential to helping her stay on track with these educational tasks. And I know a lot of the universities do have these in place, these kind of accommodations. And I think it's also rights here, one of our rights here in Canada under the IOTA Act, right, for those accommodations to on a human rights level, to make sure that she gets those accommodations. Now, overall, the individual impact on Lisa is significant and it's multifaceted, right? There's a lot of layers to peel back. She's balancing emotional distress. She's balancing academic pressures. She's dealing with financial uncertainty and also health concerns. All of this she's doing while navigating the developmental transitions into adulthood. And like I said, let me touch on it again, right? Quickly, she's going to have to mature quite quickly, right? At 18, because this has happened to her. It's going to catapult her into that transition, right? And that's not easy. We're not saying that's easy, right? So, but we're saying with the right supports, she has the capacity to move through this experience with strength and with some amount of stability. Um, I wanted to hand over back to Patricia to see what she has to say. Now, I think she might be having a little bit of challenge, so I'm going to ask Lauren, you can jump back in until Patricia figures out what's happening with her speaker there.
Yeah. Yeah, so I wanted to add into, I guess this could be covered, I guess, in a little bit of all of our perspectives, but I wanted to share that even when I was in high school, there was a course, like a parenting course, and I'm not really sure how much of like parenting kind of like sex ed stuff they teach in elementary schools now these days, but there was a experimental parenting education program where students were responsible for caring for like a lifelike baby, and they were graded on their performance, like the ones that like cry and burp and you have to feed it and all that stuff. But I guess the highlight of this class was like the role of like early hands-on learning in developing like realistic expectations with parenting responsibility. But I guess from a developmental kind of preventative standpoint, these programs could increase awareness for like physical, emotional, and time demands of caregiving, and underscores like the importance of proactive education and supporting these informed decision making and like preparedness for
Mm-hmm,
parenthood for like young teens.
mm-hmm,
I guess these kinds of courses, um, it's a discussion whether I guess they would be like mandatory or an elective. I know when I was in high school, it was an elective. It wasn't like a course you had to take.
okay.
Um, I guess to the extent where schools maybe could introduce parenting education at an early age, or whether that kind of remains an open debate. Like, I
Mm-hmm,
think it goes further than like this discussion. But I just thought of that point for, I guess, like a societal, community, and individual and family perspectives. I guess it kind of covers all of it, but
mm-hmm.
maybe that could be something
To
preventative,
be
seeing if there's
to be
any courses
explored.
like that. Yeah.
Yeah. Mm-hmm, mm-hmm. For sure. Um, okay, so to me, do you have anything else you wanted to add from the
Yeah.
societal aspect?
Yes, absolutely. I just wanted to add that from the society aspect and an aspect of nursing, we see that since we see that Lisa doesn't really have a family or parental love and care, and she's juggling university and schooling with the baby on the way, and intends to keep the baby. She would definitely need a social worker, because there's and that's working hand in hand with the physician and getting her to meet the social worker can help her in managing her finances, because she definitely at the end, if she starts when she's a second trimester, it gets a point she can't work any part-time work if she was doing any at time at before, so she can sign up for some government money or something that they give. I believe they do that in Canada here. So that training as a social worker would be a good benefit for her at the long run. Because if you can involve yourself in something that's supposed to be for adults, you'll be ready to face the consequences. So she will definitely benefit from having a social worker. So that's what I want to chip in, because we've said really, really good points. We've made really
Mm-hmm,
good point on this Lisa's case.
Yeah,
I
I
Mhm,
have
agree
a
with what Lauren said that sorry, Lauren. I agree what you
okay.
said that schools back then when we were in school they usually health education or something like that. I can't remember. So when they teach
mhm,
about biology, something like that. But I don't know if they teach you this year.
mhm,
This I don't know if they should do it this time. Now everybody's exposed. Even the child of 13, 14 knows what sex is all about. But they should try and encourage them and teach them, educate them on how to prevent it. Because definitely kids these days they are more exposed than how we were back in our own days. So they
mhm,
have to teach them how to prevent. Even she just got pregnant. What if she got an STD or she got a very bad disease? This is just
Hmm.
pregnancy, which is still okay. What about if she got an STD? So there should be, like you
mhm.
said, Lauren, there should be like a teaching and education whereby they teach them how to prevent pregnancy and how to prevent STD if they want to be involved with what adults are involved with. So that's just I agree with all what you said
And to
about that.
clarify, not to prevent pregnancy, but how to prevent unwanted pregnancy,
Yeah,
right?
yeah.
Because a
Yes,
lot of
that's
people
true.
want to be
Unwanted
pregnant,
pregnancy.
right? Yes.
Well, for that age, I don't think you should want to be pregnant for that age 18. I unwanted pregnancy, yeah, that's true, right? Thanks, yeah. Hmm.
The unwanted one is the unwanted one you want to prevent, not pregnancy in general, right?
Hmm.
Yeah, that's true,
But
yeah.
Lauren, I don't know if you were saying, I know from the graduate from being in the school, they have family studies that they still do. I don't know if any of you have seen, like, they'd have students walking around with these make believe dolls. And the dolls do everything like a real baby. So they cry when they're hungry, when they need attention, and the teacher has something that is tracking all of that. So if the baby is not tended to at a certain time, if they're not really behaving like a parent, then they will fail that course. So they still do have that. And
Hmm.
when I was in Jamaica at school, we learned about this through our guidance. We had guidance sessions with our guidance counselor. So it is still a very actively going on. At least I know from the high school level where I work that they have that child and family studies is the name of that course. So yes, some education, definitely good point. Certainly. Lauren, you had something else you wanted to add, or just to help us summarize?
Yeah, I was just gonna wrap up kind of my point of view from like a therapy perspective as well. Um,
Hmm.
so I think establishing a strong therapeutic relationship is essential given
Hmm.
her strained parental relationships.
Yeah.
Through an attachment lens, it may influence her trust in authority figures and helping professionals, even individually, but also with maybe listening to professionals or authority with like pregnancy advice as well.
Hmm.
A non-judgmental, trauma-informed, and client-centered stance is especially important for addressing her prior substance use and reducing shame and promoting just openness in general. From a systems theory, a therapist could assess the multiple systems influencing her well-being. So I think everybody kind of touched on like family dynamics, academic pressures, healthcare
Hmm.
access, societal stigma, holistic. So just to make sure that we have holistic planning.
Approach, like, yeah.
Yeah. And from a cognitive developmental theory, therapy point of view, this could involve reflective, future oriented discussions around coping, decision makings, and some problem solving related to pregnancy and education.
Hmm.
Ethical practice would prioritize autonomy, confidentiality, and informed consent while supporting disclosure decisions. Since she is 18, she's technically an adult, right?
An adult,
But
right?
making sure to collaborate with like community and campus resources, like I previously mentioned. And then lastly, just like a strength based approach with Lisa's motivation, educational goals, maybe future partner support, just like empowerment for long term well being in general. But other than that, I think everybody touched kind of on everything else that I had jotted down for the other perspectives.
So something you said, Lauren, and something that said to me, mentioned, right? Because there are a couple of things that we look at. from a cultural perspective, because I noticed you use the term, she's technical and an adult. And I
Mm-hmm.
noticed that to me kind of hinted to still like a child heading to an adult. So if you can notice the difference in terms of culture, right? And we don't know the cultural background of Lisa, because I know in my cultural background at 18 years old, you're not considered an adult, so to speak, right? Right? You're
Mm-hmm.
technically in the Caribbean or African culture, I know you're still
Yeah.
seen as a child. Even if you're not even living with your parents, right? They're just thinking at this age. So you just look at the context, and that is why maybe she is having, some of that strained relationship with her parents, and possibly one of the reasons why she decided to move out to get that level of independence or to be acknowledged as an adult, right? So we don't know. We're just kind of speculating that those could be some of the contributing factors. And
Mm-hmm.
now having moved out to try and prove, okay, I'm independent, I'm working, I'm going to university on my own. And now, this feels like a roadblock, right? So we can see like so many things would be
Yeah.
impacted, and we could go on and on, because there's a lot, right? When you talk about society, we're going to talk again about the impact on the healthcare system, right? The government is going to have to, like I said, put more money out for, whether we're looking at where did the policies fail. You're looking at housing, you're looking at, the whole healthcare system being impacted. So there's a lot of things we could unearth from studying Lisa's case to say, you know, and we don't want to say where did things go wrong, right? Because what I really like about Lisa's case, that there's a lot of strength that I see coming forward, in the sense that even though she didn't realize that she was pregnant and, engaged in activities that potentially put her baby at risk, we see her trying to take steps to wanting to learn, okay, where
Mm-hmm.
do I now get this? Where do I now get this prenatal care? And obviously she would have stopped smoking the marijuana. She would have stopped, the alcohol use. But needless to say, the damage could potentially be done. But
Mm-hmm.
we never know, right? But there's some amount of resilience there, which is good. And the fact that the baby's father wants to be involved, like all of those pieces really, really help to build, like a good outcome going forward. Does
Mm-hmm.
that make sense?
Yeah.
Yes, okay.
Yes.
Absolutely.
Yeah. So, because of the sake of time, and I don't think Patricia is having a little bit of technical difficulties with her audio. So as a result of that, I think she presented very well on her topic. So we're just gonna summarize that, unless anybody else has anything that they wanted to contribute. I think we have explored the case, and now we can, let it rest here, and then when we have future discussions, we pick up from there and do some more exploration. Does that sound like a plan?
Yep, that works for me.
Okay.
Yeah, that
All right.
works for
So
me.
okay. So, I'm going to wrap up here by saying thanks everyone for, the conversation, the insights. I really learned quite a bit from the discussions, the professional lens that each of us brought forward. We were able to identify how the different parts, work together. What are the individual impacts? What are the community impacts? We're looking at societal impacts. And did I miss anyone? I think we had about 4 headings that we explored, and I think we touched adequately on them. And really thank everybody for their contributions today, and looking forward to see you next time. Have a good day, everyone.
Thanks, everyone.
Thank
Thank
you,
you.
everyone. Okay.
Thank you. Until next time.